I'm Jill Angelo, host of the G-Spot. I speak with the most forward-thinking experts in the medical and wellness industries, all in an effort to bring awareness to women's hormonal and vaginal health. When we feel fabulous in our bodies, we are more confident, we have healthier relationships, and we have better sex. Here's to a happy, healthy vagina. I'm here with Dr. Patricia Van Satten, a longtime expert in the health and wellness industry. We connected with Patricia as a result of her background in acupuncture and a wide array of Chinese medicine modalities. She's licensed by the state of California and recognized by the National Certification Commission for Acupuncture and Oriental Medicine. And she's got an intriguing background that makes her just a well-rounded expert for our Geneva listeners who are looking for alternative methods for managing the things that menopause and midlife health throw at them. So we're so happy to have you with us today, Dr. Patricia. So thanks for joining us.
Thank you. It's a pleasure to be here.
Dr. Patricia, you have an intriguing background. So can you first just tell our listeners or just kind of take us back through your history, because you've really touched so many facets of health and wellness that have led you to the path and the specialty that you're in now. But I would just love for them to hear a little bit of your background.
Well, I started out when I was 20 years old doing massage. I was a professional modern dancer, and other dancers needed assistance. And I started by working on bodies, which I understood intimately, of course, as a dancer you do. And that led me to continue my training. I studied something called Heller work and Aston patterning and cranial sacral therapy. At 28, I went into my Heller work training, and when I was certified in that, and that's a deep tissue work that balances the mind, body, and spirit. And I opened my first clinic. And in that clinic, I realized that health was something that was really complex. It wasn't just giving somebody a pill. So we had acupuncturists and physical therapists and medical doctors and therapists and body workers. And we also did art shows. And every few months, we would curate an art show with local artists in Los Angeles and invite the patients to come and experience each other, to meet other practitioners, to celebrate art and health. Eventually, that led me into acupuncture school, into a residency in Shanghai, China, and onward to my doctorate in acupuncture and oriental medicine, and here I am today.
You know, I love that your specialty really stemmed out of dance and movement and intimately knowing the body so well. Can you just take us back to some of those early days of working with your fellow dancers, or even the women in your clinic, and even using art and health to talk and address kind of the whole body and mind and soul and spirit, because there's a real spiritual element of what you do. Can you talk a little bit about how you saw so early that it's really such a holistic perspective that you wanted to take to health and wellness?
I think as a dancer and a choreographer, you learn to experience the world in different ways than maybe other people. You begin to look at negative space. You begin to look at what is not moving. You look at, you learn to listen. You really learn to listen. You learn to listen to your body. Can I do this today? Can I not do this today? Can I push it farther? What comes from this? If I do this roll on the floor, where do I end up? And I think it allows the dancer to begin to be open to a whole dimensionality that other people don't have. And so you hurt yourself sometimes. And there you are, you're hurt and you suddenly can't do your art. What do you do? So working with dancers, helping them learn how to heal, helping them learn how to do something almost microscopically. When you're coming back from a serious injury and you do want to get back into your sport, you want to get back into your art, you don't do that quickly. You do that fiber by fiber. You do that moment by moment, figuring out what it is that's going to bring yourself back into total vitality.
That's beautiful. I think especially that notion around listening. How do you know if you're listening or not? It seems like such a simple thing, and yet I know it's a doubt I constantly have. Like, am I listening to the right things? Am I aware? Like, what do you say to women to kind of coach them to listen?
Well, let's start with what you just said. Mindfulness is about being really present. It's about accepting exactly where you are. So that's a perfect question. Your doubt, start by listening to your doubt. If you feel doubt, what does that sound like? What words do you use? Where do you feel that in your body? And you begin to just bring yourself back to the moment, back to the now.
That's great. It seems so basic, but we need to be reminded, don't we?
Yes, we do. And that's the beautiful thing. One of the things that when I asked some friends about what they felt helped them through their perimenopause and menopause, one of the ones that struck me was she wrote back 2 words, and it was a tribe. And it's so powerful. What helps us be here is a tribe. And what does the tribe do? They remind us. They remind us, you're okay. You can do this. I did this. How can I help you?
On that notion of a tribe, I know you've talked about that before, and you have surrounded yourself with your tribe. How do you know who your tribe is, or what tribe feels right?
I would say that people that support you, having people around you that support you and accept you and are honest with you. Oftentimes we can just feel into ourselves as women. We want to please all the time. So perhaps we get involved with people in our lives that we just want to please, rather than thinking about whether it's really a suitable, fruitful exchange. And I guess you just check in, and it doesn't mean you should keep anybody out. We learn from everybody. But looking to see inside, does this feel good to me? It's kind of simple.
Chinese medicine approaches menopause differently than, Western medicine or Western, medical traditions that we're used to. Can you explain kind of the main approach, or the mental model that Western medicine, or I'm sorry, Chinese medicine brings to women's menopausal and hormonal health?
I'm going to ask listeners to try to just sort of grok this. Try to let go of anything you've ever known about medicine, because Chinese medicine sounds very poetic. We talk about elements. And Western medicine is very black and white. It doesn't really have a color. So I will try. The Western biomedicine, in its black and white form, it looks at little small chemical agents like hormones. So when you go to your doctor, they check your hormones. And that's how they determine that you are in menopause. They look at your follicle-stimulating hormone, they look at your estrogen, your progesterone. And from that, they replace those little chemical agents to the best of their ability. Chinese medicine doesn't have that same kind of viewpoint, in that they don't look at things as a one name of a disease or a condition. It's not just menopause. There's many, many things. So we look at things as a balance and as relationships. If, for example, you may have more of what we would call a kidney yin deficiency, which means that your tranquility would decline, the moisture in your body would decline. Those would be kind of the things that would be, if your yin was deficient. Everyone's heard of yin and yang. If your yang was deficient, you might feel heart palpitations, insomnia, forgetfulness, dryness. And so we would address those different imbalances of yin or yang with herbs and acupuncture. The other thing is that, going not just into the specific symptoms that a patient might have, we kind of have to look at local biologies. And that means the culture. Chinese women do not experience menopause the way women in the West experience it, or even women in Japan. We have to look at the climate. Are you in a cold climate? Are you in a warm, damp climate? Those kind of things really make a difference. What is available to you? Are fresh foods available to you? Are you able to get outside and get sunlight and vitamin D? An absolutely essential element for health and vitality. Or do you need to supplement it internally?
How do you know what is environmental versus something else?
One of the things that we try to do is how to change your internal environment. Now, that can be how do you deal with stress. Maybe you cannot give up your job. You have a job, and that creates a financial stability for you. You certainly don't want to change that. But how do you change the stress of the job? Well, there's many, many ways. And, your acupuncturist and Chinese medical practitioner, will probably work with you to, develop that observation that we were talking about earlier. Do you need to cut down on coffee because it's making you more stressed? Sugar. Do you need to get outside? How about meditation? Do you need to go to a therapist, or perhaps even go to your boss and say, I'm going through a change in life. How do I keep my job and keep my sanity? Is there a way that we can work this out? Really respecting yourself, respecting the process that you're going through. Now, obviously, you can't always do that in your job, and you have to find ways to do it with your family, with your food intake. If you tend to get chilly, maybe that's what you have. You have a yang deficiency, and so you tend to get more chilly. So you wear a sweater. You bring a sweater to work.
So, just to kind of look on myself for a moment, I am a person who has night sweats, and I have since I was 34 years old, and I'm in my early 40s. And it's just something now I just kind of deal with, and it's always around kind of my menstrual cycle. How would you just hearing that little bit about me, over the phone, would you kind of assess that, I'm deficient in yang, and how would you kind of recommend I start to approach that?
Well, I would probably give you an herbal formula. So the herbal formulas are wonderful. They really are. They're natural ways to balance the body. And herbs can do really wonderful things. And they literally can help your body produce hormones. They are not hormones, but the scientific research shows that they can help the body produce hormones. They can strengthen your body. They can strengthen your body's hormone receptor sites. That could be a problem. There's lots of research going on about how to bring the body into its most vital place. So the first thing I would do with you we would do a probably an hour and a half interview and go over many, many things, including your diet and exercise. I would look at your tongue. I would listen to your pulse. I would listen to the sound and quality of your voice. And from that point, I would probably prescribe you an herbal formula and have you do that herbal formula for probably 2 or 3 months to see how that regulated you.
And where do you source herbal formulas, or how do you direct usually your patients and clients to kind of find what you're recommending or prescribing?
I have an herbal pharmacy in my office of already pre-made formulas, and I have companies I work with that can make a specially designed formula. I recommend that people, if you're in a town that has an Oriental medical school, that you go there because they will have fresh herbs, and they will go into their pharmacy and prepare you a fresh herbal formula designed just for you. And that's really exciting. That's really fun, and that is the best way to get your herbal formulas. It's a little bit prohibitive for a private practitioner to have a room the size and the extent and complication of a formula of a fresh herbal pharmacy, but you can do that. Or I can write a formula for you, and if you have a Chinatown in your town, you could go down and get it there. But the pre-made formulas are fantastic, and I have certain companies that I work with that I find really do great work, and I work directly with the herbalists in those companies, so that I'm always able to ask them questions. I do not know everything, and there are people that know so much more, and so being able to work with the companies, call the herbalist myself, discuss the patient with them. They can say, yes, use this or these two together, or it's a wonderful kind of alchemy. There are really wonderful companies here in the United States that we know where the herbs are sourced. They can often be organic or mostly organic. They are usually run by people that are very passionate about providing quality products. And they've been doing it a long time. So I think I was saying that finding the right herbal formula and the right acupuncture treatment and the right exercise and all of that is an alchemy. It brings together for each particular and unique situation sort of the magic elements.
Chinese medicine and even acupuncture is still somewhat an unknown to many, I think, Westerners and Americans. When we think about Chinese medicine and the whole realm of it, is acupuncture always a component, or is that in your in your world what you really espouse to, or what are the different if what you just kind of mentioned was herbal medicine and acupuncture and diet, it's like all integrated, it sounds like. And are those kind of all the facets of Chinese medicine, or are there components of it that we should think about when we're exploring it for our own selves?
Well, definitely. And I live in California and practice in California. And in California, you must be proficient in both acupuncture and herbal medicine. So the schooling here requires that you do that. There are other states where you can do just acupuncture or just herbal medicine. My national license, I needed to take a test in both of those. In China, I was so surprised to find out that they are also separate. There are acupuncturists and there are herbalists, and they are not the same, which was really quite interesting, because it also allows, to find somebody that just does herbs. You really are getting someone who is just an herbalist. So I guess I'm more like an internist in Western medicine, and then somebody else might be like, a neurosurgeon, or somebody who has a particular, specialty where they just do knees.
How do you kind of coach first-time patients through what you offer them? Because there's probably with any unknown and a different approach to health, there comes all sorts of uncertainty. How do you tend to coach someone who's never experienced Chinese medicine or acupuncture or even herbal medication and supplements? How do you coach them to this place of comfort and understanding and trust?
Very slowly. I like people to know that we're going to start with just one needle. I want them to have that experience. I want them to feel the needle and to give me permission to do another one. You're entering into people's space, into their energy fields, and actually into their bodies. So, my particular approach is to do things very slowly. As you probably figured out, I love to talk. I have to moderate myself and try to pace with the patient. One of the first things I ask a patient is what are their goals? What is it they're looking for? And then I try to keep that in mind as I say, this is what acupuncture is, this is what you might expect, and then have them report back to me. And the same thing with an herbal formula. I try to never give more than one formula at a time, because we want to know, does it cause diarrhea? Does it make you feel better? Does it make you feel nauseous? Which they don't usually, but you would never know if you gave somebody too much. So I go very slowly with people, and I do try to educate them on what Chinese medicine is, and I'm happy to say that a lot of my patients are now quite proficient. After years, they know a lot. They'll call me up and say, "Oh, I think I have some spleen qi deficiency."
That's awesome. That's great. Well, knowing that we can't all come to Palm Desert to see you, how would you recommend our listeners, what should they look for if they're going to source a Chinese medicine practitioner or an acupuncturist? What would you recommend? Like, what questions should they be asking?
Well, first of all, I would, recommend that they go through the nccaom.org website and see if there are practitioners that are certified by the National Certification Commission in their area. And they can then contact those practitioners and ask them about their schooling, ask them about the length of time they've been in practice. I think it's a good idea to actually go and do a consultation, get to know and see if you like the way somebody interacts with you, because it's a very intimate experience about a very intimate problem.
And how do you, coach the patients or the women that come to you that might be looking for a quick fix to night sweats or to foggy brain or some of the other, just irritating things associated with menopause? How do you kind of almost establish expectations around patients and your approach to it?
We all want to feel a mastery over our body, and when we're beginning in menopause, it feels like this runaway train. So the first thing I can say is, begin to use that observation. I sort of have this feeling that as you have only so many eggs in your ovaries, you have only so many cups of coffee in your life. And when menopause starts coming around, it seems like you probably should cut down on the coffee. That's one of the first places that makes a dramatic change in how people feel. So if you're used to drinking 2 or 3 cups of coffee, I recommend that you slowly begin to reduce that and keep observing how you feel. And I think that people will find they don't have as many temperature changes or anxieties, that there are many ways that you can really help yourself. Please get out in the sunshine. Go take a walk. Those kind of things are things that you can do.
In your field of practice, I assume that every treatment is very unique to every woman, but are there general things that any woman should be doing as she enters midlife and menopause that you recommend on a regular basis?
Certainly everything that I've mentioned. Really make sure that your nutrition is supporting you at all times. Don't go for a long time without eating. Try not to eat snack foods, processed foods. Watch your alcohol and coffee and tea intake. For sure, look around to find areas in your life that bring you joy, something outside your regular world that can bring you some nourishment, so that even if you're not feeling well on a particular day, you can just carry that alongside you rather than having it be the obstacle in front of you.
Well, and being a specialist in movement, I assume movement is part of your daily regimen. What do you recommend to women in terms of moving their bodies and, just nourishing that way?
One of the greatest things you can do, and I think it was Mae West did this, I can't remember, but before she even got out of bed, she stretched. And I think it's a wonderful thing to do. Think about how you start your day. There's a wonderful I Ching saying, how you start your day is how your day shall be. So wake up, think about positive thoughts for your day, and begin to stretch. Feel your ankles, roll them around, shrug your shoulders. Let your body begin to wake up. Have a positive feeling towards yourself as you get up and the things you do. I strongly believe that walking is the best possible thing we can do. And when people ask me how long to walk, I say, walk until you feel the shift. And everybody knows what that is when it happens. So if you can only walk for a few minutes, the other thing you might do is always try to walk and see if there's something on your walk that you've never seen before. I never saw that mailbox. I didn't see that tree. I never noticed the color of that door. Keep bringing yourself present. Pay attention to your breathing. Mindful breathing is the key to a happy life.
When we spoke before, you had mentioned that, menopause is a time to celebrate. And a lot of women don't feel like celebrating and feel like, oh, we're just trying to put a sugar coating on something that's really tough and difficult. Can you respond to that and your notion around menopause and midlife as a transitionary point in a woman's life where, embrace it and celebrate? And what do you mean by that?
Well, I would suggest that there were societal pressures and attitudes that go along with not feeling good about menopause. And if we can begin to just sort of disentangle ourselves from the notion that a fertile woman is a productive, vital member of society, and that a woman who is no longer fertile and procreating is not. And we live in a very different world now. We are contributors in every single way. So I say, find out what it is that you are beautiful, what is beautiful within you, and begin to let that creativity come out. And I promise you, having been through it, not having cramps, not having to change plans or whatever because I'm menstruating, it's a freedom. It's really a freedom. It's, you have the ability to be all you can be. And so that's what's a joy. And you also have the ability to take responsibility for your health. And I think that little by little, as we disentangle ourselves from sort of self-thoughts and societal thoughts, we can realize our full potential, that each and every one of us is so valuable and so beautiful and has so much to give.
Well, thank you. What a perfect way to close this really meaningful conversation. Thank you, Dr. Patricia. I think it's an area of health and well-being in medicine that so many women want to explore, and there's a lot of mystery around it. And I appreciate you sharing a little bit about what you do and about your field. If anyone wants to look up Dr. Patricia, her email or her website is drpatriciavansanten.com. She's located in Palm Desert, California. And one other site you brought up during our talk that I just want to kind of restate is nccaom.org. That's the National Certification Commission for Acupuncture and Oriental Medicine, and that is the organization and site that Dr. Patricia mentioned around looking for a Chinese medicine and acupuncturist in your local area that might be able to help you and bring the same relief and wellness that Dr. Patricia just talked us through. So again, thank you, Dr. Patricia. I appreciate you spending some time with us today.
Thank you so very much. I enjoyed it.
Thanks for listening to the G-Spot. We welcome your feedback at geneve.com. That's GENNEVE.com. You can follow us on Facebook, where you will see more on show notes. And subscribe to us on iTunes, and you'll never miss an episode. The G-Spot is produced by Shannon Perry. Theme music by Smitty. And from all of us at Geneve, think happy, healthy vaginas.